you should come and visit the specialist earlier because the clock is ticking for both the partners. There are certain indicators when you are supposed to visit your specialist, your urologist earlier. Earlier means at 6 months of regular unprotected intercourse. Now I will summarize it under 9 headings. Number 1, advanced paternal or maternal age. If your age is 33 or above for both would-be mother and would-be father, then you should come and visit the specialist earlier because the clock is ticking for both the partners. Although the advancing age affects and impacts the female partner more than the male partner, the number and quality of eggs decrease faster and the decline is much more pronounced in females as compared to the decline in male partners' sperm quality and counts. Number 2, any genitourinary infection. Number 3, any sexually transmitted infections. These infections are curable and are very important correctable cause of reduced fertility. So you must go and meet the urologist and gynecologist to get yourself evaluated and treated timely. Number 4, any history of urogenital surgery. Because after surgery, there are certain changes which can happen in the anatomy and physiology of genitourinary tract and they need to be addressed timely. Number 5, any history of cancer disease or any current diagnosis of cancer disease in any organ of the body for both males and females. Because it has been found that cancer disease in any organ can have a lot of negative impact on the fertility potential of the individual. And also, when a cancer diagnosis is made, you are supposed to undergo many investigations like CT scans, exposing you to a lot of radiations. And after the diagnosis has been made, the patients are usually required to undergo surgical treatment or chemotherapy or radiation therapy. All of these can have a lot of negative impact on your fertility potential. So it is always advisable whenever this kind of diagnosis is made, you always discuss your future plans with your physician, with the fertility specialist. If you're planning to have children in future, then it is advisable to go for freezing of sperms and ovum freezing, which can be utilized in future for IVF. Number 6, absent testes, either on one side or on both sides. If the male partner notices that he has only one testicle, or if he doesn't feel any testicle on both the sides, then this is an indication to go and meet a urologist timely. Number 7, varicocele. If the male partner notices a swelling around the testicle, which increases on prolonged standing and working and decreases on lying down, then this could be the sign of varicocele, which is confirmed only after you meet a urologist when he examines you, and sometimes it needs an ultrasound for confirmation. If you have a varicocele, this is an indication to go and meet the urologist timely at an early stage. Number 8, testicular swelling. If you have any kind of testicular swelling which you have noticed recently, whether painful or painless, you have to go and meet your urologist as early as possible, because these swellings could be anything from infection to a simple hydrocele to a malignancy or a cancer. If you have noticed any new onset swelling in one or both the testes, go and meet the urologist early, as soon as possible in this case. And number 9, if you have undergone a semen analysis while getting evaluated for fertility problems and you have been found to have sperm parameters which are declining on subsequent semen analysis, then also you should go and meet a urologist, because this has been found that the sperm parameters may decline continuously without any obvious reason and going down to near zero. So if this is happening in subsequent semen analysis reports, go and meet a urologist and discuss if there is a correctable cause or if you need to freeze your sperms. So these are the indications when you are supposed to go and meet your specialist as soon as possible or within the timelines discussed above. Do not hesitate, because the problem of fertility has become a challenge because the patients hesitate in coming to the doctors, meeting them, discussing their problems and getting a timely treatment.